If you've been told that you're overweight or too fat to have hormone replacement therapy, then I want you to watch this video. If you've never been told that before, then scroll past. This isn't for you. I've had so many comments in my inbox of women saying to me that they're overweight and they've been denied hormone replacement therapy. So is that true? The simple answer is it's not true at all. You can have hormone replacement therapy if you are overweight. It just has to be risk assessed to you. As always, I will break down the evidence and the data behind this so you can take this to your healthcare professional and have a discussion about the choices that you want to make in regards to hormone replacement therapy for the management of your menopausal symptoms. The global obesity pandemic continues to rise, with figures from the World Health Organization showing that in 2022, 1 in 8 adults in the world were living with obesity. For women, whether this increased obesity as a consequence of menopause, age, genetics, or environmental factors have long been debated. Obesity has a significant implication with an increased risk of cardiovascular diseases, type 2 diabetes, metabolic syndromes, and several cancers. Increasing life expectancy means that women spend a significant part of their lives in the menopause. As such, understanding this complex interplay of obesity and menopause is important to providing the right advice and management for women. This paper from 2023 shows that the menopausal transition is associated with an increased risk of obesity. So you transition from fat accumulating mostly around the hips to visceral fat accumulating mostly around the tummy or the abdomen area. And this can have further worsening risks associated with your heart health or your metabolic issues. The British Menopause Society have got this paper on their website which shows that weight gain is one of the most common side effects of perimenopause and menopause, affecting at least 50% of women. Evidence from the SWAN study and the Healthy Women study suggests that on average, women gain about 1.5 kilos per year during the perimenopause transition, resulting in an average weight gain of about 10 kilos by the time that menopause, so 1 year without a period, is reached. And remember, perimenopause can be for about a decade. Most of this weight, again, accumulates around the tummy and the upper body because as estrogen levels are reduced, visceral fat increases from 5 to 8% total body weight to 10 to 15% total body weight. And therefore, this also affects your metabolic rate slowing down and your lean muscle mass also reduces. This paper and guidance is well worth looking at because it gives you so much information around nutrition and movement and what is good to do. But one of the things that it does say is that you cannot deny hormone replacement therapy to a person based on their weight. A lot of the advice around hormone replacement therapy, and if you're overweight or obese, was around the oral synthetic tablets, which were considered to be linked with a high risk of developing a clot. But the NICE 2019 guideline says that if you are, for example, obese and you are considering HRT, you may be offered patches or gels rather than tablets. So that's body identical patches, gels, tablets such as utrogestan, micronized progesterone, and these are safe to have if you are overweight. It's also important to note that large studies of estrogen-only therapy in surgical menopause completed in both America and Denmark have demonstrated that long-term estrogen therapy in surgical menopause, for example, 5 years and above, may actually reduce the risk of cardiovascular disease, breast cancer, and does not appear to alter the risk of clots, strokes. So it's really important that in surgical menopause, when you have your ovaries removed and your womb removed, actually it's showing that having estrogen or hormone replacement therapy given back to you is actually beneficial. Here is where I stand as an NHS GP specialising in women's health. You cannot deny a woman hormone replacement therapy for her menopausal symptoms if she's overweight or obese. It's actually ethically wrong. The replacement of estrogen, progesterone, testosterone that need it have shown time and time again that they help with brain health, bone health, heart health, and cognitive function, which helps a woman engage further with making better nutritional choices and have movement in her day as well. So as a doctor, please, if you have a woman, assess her in front of you in regards to risks versus benefits, but do not deny her hormone replacement therapy based on her weight. If she has a higher weight, what I do with my patients, I look at their risk of history of clots, risk of breast cancer, risk of endometrial thickness, because we need to make sure that we have adequate progesterone cover if she has a womb in order to make sure that the endometrial lining doesn't thicken up. I also look at her cardiovascular risk by doing a Q risk score as well. And I would do that for every single patient. Your weight is not the determinant of whether you get hormone replacement therapy. In fact, I believe from all my clinical work and the data is suggesting that the earlier that we start hormone replacement therapy for menopausal symptoms, and not wait until you're struggling and on your knees and you're putting on lots of weight, as the British Menopause Society data suggests that women do put on at least 10 kilos in the whole transitional phase until they get to menopause, then you're better off making sure that women are supported enough in order to get engaged in exercise and nutrition. And by giving you hormone replacement therapy earlier rather than later, means that we're able to then make sure that other risks don't develop later on in life. So in fact, what I say to my patients all the time is start making decisions in your 20s and 30s, so your body will thank you in your 60s and 70s. And it's never too late to start in your 50s and 60s, so your body will thank you in your 60s and 80s. I hope that's been helpful.